But I want to start from this is a really good quote in my opinion. And in order to keep or support a vibrant economy, we have to keep the regulatory system clear, simple, and easy to administer, and then live with it. So that's the some kind of like I feel the connections that I can make with this little case study. And also the beauty about occupational licensing conferences is that you don't have to spend a lot of time to reference all those amazing studies because everyone knows about this and everyone talked about it. And I just want to kind of like, bring a little bit of point in terms of like the basic professional licensing laws, like what's the key points and how does this impact like, workers or our local economy or even national, international economy. And I also want to kind of like bring a little bit of reference into the institutional economy rules that we kind of like, I don't know, less touched in so far. Because, many people talk about people are rational decision makers and stuff like that. And I want to kind of go back to see that sometimes, as the panel discussed, when we talk about occupational licensing and the economic impact of occupational licensing, we cannot really kind of like ignore the political, social, and all the demographic factors that impact this decision, right? So from the institutional perspective, we talk about market is a result of complex interactions of various interactions, individuals, firms, states, social norms, right? And of course, one of the important part is from this whole framework is really talking about government as a mediator to really kind of regulate these interactions. So in terms of focusing learning, boundary rationality, and evolution. So I think like more is like, I couldn't find a better kind of like, speaker ahead of me talking about the diffusion and evolution of occupational licensing, because like, this particular little study is also kind of inspired by your 2015 book when you talk about the case studies by separate occupation. And my initial intention for this research is really study why did we get there, right? We have been, Morse has 4 decades of work, and many of us in this conference have started document the negative impact of occupational licensing, right? But like we still see a progressive kind of like, more stringent occupational licensure legislations being passed over time. So why did we get there, right? Like how did things happen if we know this is having some really significant negative impact to the labor market, right? So my initial kind of motivation comes there, but since we already moved to the stage that majority of the, I would say, licensable occupations already being licensed, and so I move a little bit step further to see, if we want to see a kind of a process of really looking into how did we get to certain occupational licensing, and maybe I need to take a little step forward to talking about certification, right? Like, if we really truly believe certification has all the benefit that we hoped for occupational licensure, without the downside of the occupational licensure, is this really a viable kind of like approach? Or how does government or regulators working towards achieving this kind of like, I would say more beneficial kind of outcome? So because I'm from Canada, so I'm gonna throw in a little bit kind of international aspect in this. And also this is kind of like the first step of a comparative study. So the study I will study is between like the difference between Canada and the US as well. So just give you a little bit kind of like Canadian context. I showed this in my later conference presentation last year. And I want you to kind of like pay a particular attention in terms of number of certified professions. Because in Canada, this is how we define right to title. Okay, that's the certification that you see. You can see there's a little kind of like a variation across different provinces, but not so much. Okay, so in general, what you see is that we didn't see a lot of variations and a lot of aggressive right to title certifications in Canada. The research question is kind of like open at this point. Like I list something talking about different stakeholders that are related to the legislation related to the occupation licensing / certification. And I want to get a sense about what's the kind of like, path or process for us to really get an occupation to be certified or recognized in the labor market. So that's the overarching theme that I want to talk about. Okay. And this is more like a mixed method research. And so far, majority that I have accomplished is qualitative part that I interviewed the case stakeholders and I reviewed the legislative document, also like, the organizational document from the professional kind of like association. So the case study I use is human resource management professionals in Ontario. Give you a little bit kind of background talking about this regulatory body. The HRPA was established in 1979, and they have been the kind of official human resource professional regulatory body since 2013, when they passed the Public Act. I will talk a little bit about Public Act a little bit later. Currently, they have about 22,000 members working in about, I think, a little bit more than 8,000 organizations. So, and they have been, with this 4% annual membership growth since they established the occupational licensing kind of licensure regulatory body status. Okay. And like I said, they have been there and they have tried to kind of like, build the professional status of human resource professions for almost 4 decades. And if we look at their organizational mandate, we see that only after they got the occupational regulation law, they start adding this argument about protecting the public interest. Before that, it's always about, we need to make sure that the province-wide standard being met. We need to establish HR as a profession. We need to make sure that we have a maintained discipline of the members. Okay, so there's a little kind of like, movement in terms of how they, I would say, justify their occupational regulation kind of like a status, but that's what we saw in their mandate. They also made a couple of changes since they get this Public Act. Okay, so after 2013, they become the regulatory body. They get their right to kind of like a title. They start building this new competency framework. They used to only have one reserve title, and now they have 3 different levels, and they add separate comprehensive knowledge exams for different level of HR professionals. And they also added 2 law exams. Those law exams is really, really difficult. It's 700 pages of prep works for you to do, like, 125 multiple choice within 4 hours. So it's gave many HR students a lot of headache. And they also added a job ready program. So basically that's 4 hours training for students to understand the act, this occupational licensure laws in HR that they passed, and saying that, hey, now we are really a serious professions and you need to understand the clause for those. So the first question, like, I try to get a sense about, why do government grant this right to title? Okay, and of course, the kind of follow the standard political economic theories, and then what Morris discussed, the first one is always protect the public interest. And this is what we get from, like, I interviewed the board of directors of HRPA. I try to find the legislators who kind of promote the act. I try to find the administrative clerks who's actually filing the act. So, like, I interviewed those people, and this is kind of like the justification they talk about. Yes, they had a really hard time to figure out, why do we need to protect public interest for the field of HR, right? Because HR, human resource management professionals, they typically do not deal with customers directly. they deal with internal customers within the organization. So for them to find a reason to say, hey, we need to become a kind of like a regulated occupation for the public interest is kind of weak in terms of argument. But eventually, like after, because this act was passed in 2013, but it was first introduced in 2010. So it took them 3 years to finally kind of like, reason with everyone and understand, okay, now we have an understanding about, disability, we have an understanding about, discrimination in the workplace. So HR has a rule in terms of being professional, being considered as regulated occupations. They have a responsibility to protect public interest. And the second part is really, we talk about the diffusion of the occupational licensing. And in other fields, we talk about the past dependencies and the isomorphism, right? Like, why do occupations, certain occupations regulated first and then move to other occupations that, how do we kind of have this overall diffusions across different occupations in terms of occupation regulation? So from the HRPA's perspective, they said, okay, they're working on new acts. Okay, so for different occupations, we were talking about accounting back then. And then suddenly people realize, hey, maybe we can bring something to the table as well, right? So they also talk about, it's not they just invent this occupational regulation laws out of blue. They used to have a private act. When you define a private act, that's typically saying that, hey, that's not relevant to the general public. This is just a matter for a few small, number of people in the society. So if you want this, we can give you. It's less kind of like I would say, demanding in terms of provide the necessity, approve the necessity to get the act. So in this sense, they start talking about, hey, we got that around 1990. Okay, so for the past 20 years, we had the private laws. Now we start wanting a public one because we think it's time. Because every other professional occupations, it seems like it's doing the similar thing. And also, seems like, there's a discussion back then talking about we need to regulate the occupation. We need to have a more government oversight. But the government does not have the capacity to really recognize, what's the right practice, what's the good practice, what's the quality practice. So we rely on the professional to make the judgment. And the delegation of responsibilities start become a discussion. And here they're talking about MPP, that's the equivalent of, the state congressman in the US context. So a couple like, really, I would say MPPs back then, I tried to interview them. Like I didn't get a response from 2 of them. They denied to comment, but some of the discussion, background discussion talk about, because the MPP always need to kind of put some kind of like a bills in the table, but back then, during the vacancy of some kind of political discussion, so they say, we don't have anything that we can offer, so let's bring this to the table because I need to get something to fill the vacant, right? So in a sense that there's a political support into this. But on the other side, people also mention that, sometimes government are fickle, right? Like, they could give you support this time, but next time they're gonna change it. It just needs some kind of a political event to trigger the motivation for them to provide the support or withdraw the support. And of course, the last interesting bit that we find in this particular case is that within the HRPA, there are people really wanted the regulatory status. What I find is that I review the annual report from the HRPA, their regulatory body, between 1990 and 2015. And I counted the number of frequencies that was regulation, regulator, and regulatory appeared in those annual report. You can see clearly for the past like 20 years after they get the private act, nobody actually talked about this. Only when they hired a couple kind of like an internal champions. They hire people that really want the regulatory status. They start having this kind of discussion in the annual report, so in their actual document. And this become kind of like a more, I would say, frequent discussion within the organization. So here, like some people on, because I think many of the discussion that here in our group is we always assume that, certification is a stepping stone for licensure, right? So we want to ask the same question, like I want to ask, is that really kind of like the case? That's the reason that I also want to kind of study the HR in Canada and in the US as well, because I want to see, like, is there really the case that, those paraprofessionals who's currently being certified, are they really plan to get the licensing kind of like status? Are they really try to move up? But what I find in the Canadian case is that some people kind of like recognize the transition. For example, this guy saying professionalization is one of the two strategies to achieve status and respect. But many people think, and they also talk about getting powers and being more influencing in the public kind of like, discussion in the policy realm and getting legitimacy. But majority of the board of directors, they do not understand the difference, and they do not think licensure is something that it was pursuing. Okay, so there are many different reasons. I'm not going to talk about these reasons because we can get into a whole different kind of like a discussion. But one particular kind of concern is that, as referenced here, HR is not a doctor, is not a lawyer, so we don't have the power to control the market. If we don't have the control, then the compliances become a too resource demanding, and why would we do it? Okay, and if we start looking at the other stakeholders in this whole realm, so we move from the board of directors, the people who's actually like, making the decisions, actively pursue the licensing status, the regulation status, and then move to the actual members. So the board of directors have a very clear understanding, like, the knowledge about regulations for their members is pretty minimum. It's pretty much lacking. I was lucky enough and get help from the professional association. So we did a survey. And then after the survey, we did a phone call interviews with their members. Okay, so when we ask, how do you define, how do you describe the mandate and the mission? Very little people talk about the protection of the public interest. And when we ask, like, how do you perceive of HRPA as an organization, many people talk about association. And many people are talking about regulatory body, but not so much as a professional regulatory body, which HRPA is supposed to be. They are no longer a professional association after the act. And the final part about this is we really ask, how does the regulation kind of impact you, right? And majority of them saying that there's no impact at all. So continue the same kind of line. After the survey, I did a phone call interviews with those members, especially the new members who joined the professional association, get certification during the transition period. And many of them saying that I don't recall any discussion. And I remember I was giving a piece of paper with some discussion, but I have no idea. I just signed it because it's required by my admission package. And some of them thinking, it's related to something in terms of protect the title, but none of like the interviewees that I got talked to actually mentioned the correct term or underlying meaning. So it's very, I think the understanding and the acceptance at the membership level is really low. And I also want to get a sense about how kind of like a market, the employers or the business really see the value of the certification. So I did a job scraping, like I scraped the job ads from like a multiple platform and then relate to the HR jobs. So literally just counted how many times they actually listed they want this professional designation. So among the almost 6,400 job postings, less than 5 actually required the HR designation. Okay, and another kind of like 7.6% around saying they prefer one, they recommend one, or they see this one as an asset. Okay, and there's no significant kind of changes between like the period that I was looking into, like which is almost 18 months apart from each other. But there's some evidence suggesting the signaling effect, because when the job posting says we require a designation in the HR, they typically don't say, we want any degree, or they don't really mention the experience requirement, because if you want to kind of get the designation, there's a certain requirement in terms of how many hours you need to practice in the field of HR to be able to get the license. Really not the license, it's the certification. Okay, so that's like, what I got so far. And to summarize the perceived by different stakeholders, we see board members are aware of the implications of regulatory power, but people are not on the same page. Okay, there's a very different understanding in terms of what does this mean? And most of the professional association members don't really understand what does it mean. And employer recognition of the certification is still minimal, because I guess HR is not really some jobs that are with exclusive scope of practice. So people can actually learn on the job. So from what I so far gathered the information, I think there are a couple of challenges in terms of right to title. The first problem is this agency issues, right? Because we talk about the associations, they become the regulatory body, and it's really hard to separate this, what we call the professional workers club, versus really some kind of designated associations or agencies to have some kind of like legislative power, or not really legislative, governing power, let's put this way. And the challenge is really, how do members identify themselves with the professions themselves and also with the client? What are the incentives for them to really engage in this particular certification? Because it's really costly to achieve, and it gets more costly after they become a certified right to title occupation. And also it's really expensive for them to maintain because of the continual education requirement and the annual member renewal fees. Okay, so what's the benefit for them? And what's the benefit for the employers to really get sense about what they can get in terms of quality of services? And also derive internally, and what's going on there, the trade-off between having the really good member, like member with good practices, and in terms of how many members they can kind of like attract and retain in their professional association. So the key issue goes down to like really the compliance issues, right? Like if you have the regulatory regulations kind of like status, you need to make sure that your member actually complying with it. So that's the question we get. Most of the people saying that, oh, okay, we're committed and we're going to be compliant. But so far we see when they have a most stringent entrance requirement, the enrollment or the application number goes down, and also more people start like stopping renew the membership. So I think they're the part of policy consideration as well. Like what are we, what can we learn from this particular case study? Should government really move away from licensure towards right to title? Because so far what we see in this particular case is that even though they don't have the right to practice, but all the education requirement and the practice requirement is getting the same kind of like, increase. I want to close my kind of like case study with this. right? I talked to a regulator, and this his kind of like feedback in terms of what's going on with more kind of a discussion in the redundant or over-regulated occupational licensures happening in the US. And what he said is it used to be that regulators were really passive, like waiting for something to go wrong before doing something. But now, like, because we have this research, because like a more evidence-based, you know, policy decision-making, people start looking into this and saying that, hey, we need to intervene before problem surface. But they really need to think, how do we intervene, and where are we going to get started? Because, you know, we already have a situation with significant licensure in the labor market. So are we going to reinvent? Are we going to kind of step back, or are we going to cut these things? How are we going to do it? So there's more kind of policy discussion in terms of, like, you know, how do we fix the problem at this point? So thank you.
Thank you very much, Tingting, and thank you to all our panelists. I think in the interest of time, we'll dispense with questions, but please feel free to ask any of the panelists during our dinner, or there is a private chat feature if you like. You're welcome to use that. We're going to take a 10-minute break, and after that, we will resume with Bobby Chung's presentation. I'll see you all shortly.